I'm Layla Abdullah, Teacher Development Co-Lead, and thank you for watching this short video where I'll be explaining the recruitment pathway for patients into the patient bank for the GKT Medical School's OSCE examinations. Have you come across any patients in your clinics or teaching sessions where you've thought to yourself, they would be brilliant for an OSCE station? Well, here's the chance for that thought to come to fruition. QMEC are involved in recruiting patients from primary care into the patient bank for the OSCEs and patient expert teaching sessions. And we'd appreciate and really need your help with this process. So what type of patients are we aiming to recruit? Patients who are clinically stable and well enough to spend 1 day to half a day on campus being examined by medical students in the OSCEs and or in teaching sessions. So all patients will be risk assessed for face-to-face or virtual sessions in the context of the pandemic. Patients with clinical signs associated with any system are needed. So think osteoarthritis, rheumatoid hands, thyroid disease, surgical scars, varicose veins, diabetic feet, heart murmurs, atrial fibrillation, nerve palsies, peripheral neuropathies, bronchiectasis, COPD. So all the common diagnoses that we might encounter on a day-to-day basis. Patients might ask what's the benefit to them. So over the years, patients who have been involved in OSCEs find it very fulfilling and feel happy and proud to train the next generation of doctors. There is an honorarium which is available in the form of vouchers, and that's offered to patients. Travel costs are also reimbursed. So what would be your involvement? If you come across any suitable patients, we kindly ask that you explain to the patients what an OSCE station or teaching session might involve and what the patient's role would be. You can also provide them with a leaflet. The team would then need some details from you, including the patient's name, contact details, brief symptoms and signs, and confirmation that they're happy to be contacted. In the first instance, please email undergraduate@gstt.nhs.uk, and that email's up on the screen. So what are the next steps? If you're able to help or have any further questions, please feel free to contact me. My email address is up there, or the medical school's organising team. And we can send across an electronic poster and leaflet, which can be displayed on your website or in the waiting room, for example. Our social media pages are also up there, which will have more information. Thank you for listening.